Welcome to Medicine Talk ND Live, where you can discover life without medicine. Join us live 12 to 1 CST every weekday, where you can talk to a naturopathic doctor for free and learn more about naturopathic medicine. ND Live is brought to you in partnership with FullScript, the doctor's choice for delivering the safest source of professional-grade supplements to their patients.
Hello, everyone, and thank you for joining us today. I'm Dr. Eli Camp, one of the founders of Medicine Talk, and we are here today with Dr. Kirby Thompson, and we're doing interviews with the doctors who participate in ND Live, which is an opportunity for anyone out there in the world to call in between 12 and 1 Central Standard Time every weekday and some weekends to chat with naturopathic doctors, find out if this is something that's a good match for you in your healthcare, learn more about it. It's really awesome. People are really enjoying it. And I think it's nice for you to see the doctors that you're actually talking to on the phone. So welcome, Dr. Thompson. So glad you could take the time to talk to us. And
Thank you.
You have a couple of practices, one in Hattiesburg, Mississippi, and where else?
And my other practice is in the Lake Norman area in North Carolina, both Mooresville and Huntersville.
Wow, that's beautiful country.
Oh, I love it. It is wonderful. The people here are amazing. I really am enjoying it.
Oh, that is great. Is it cold? Has it turned cold there?
It is very cold. It is, well, it's cold for me. Coming from Mississippi, like 50 degrees is cold. Now, I lived in Chicago for 6 years, 6.5 years, where I attended both naturopathic and Oriental medical schools. And -2 was, the norm in the winter. So it's interesting how the body adjusts, because being in Mississippi for 2.5, 3 years, I just get breathing. It is hot all the time down there.
Oh, well, we lived on the Gulf Coast in a little town called Ocean Springs in Mississippi years ago. That was completely wiped out by Katrina. It's gone. It's not even there. The whole beach is gone. All the apartments, everything. Yeah.
It was, the devastation of Katrina was so much greater in Mississippi than it was in New Orleans.
Yeah.
But because of the fiasco, they got all the press.
Yeah. That's how it works, isn't it?
Oh, yeah, always.
So tell us a little bit about your journey. Like, why naturopathic medicine? Why did you become a naturopathic doctor?
Well, my father, I was an MD. He was always into the alternative complementary. And, so he dabbled in orthomolecular medicine, which a lot of MDs know as vitamins, supplements, and things like that. And he did IV chelation and Myers cocktails, which is, the vitamin bags. So I was exposed to things, but I did not understand how deep it could go and how great the healing part of the medicine is until my father actually got sick. He got encephalitis of the brain. He had herpetic encephalitis. He had 2 fever blisters on his frontal lobe. And he woke up and thought it was 1973. And it was devastating to my family. And my cousin, who was in Mississippi, they owned a health food store. And her husband had prostate cancer and was given 6 weeks to live. He was a real estate agent, and one of the people he sold a house to said, "You have got to go see this guy in Florida. He's a naturopathic doctor." And they were like, "Okay, whatever." So they went to this naturopathic doctor for once a month for a year, and he got okay. He died, the prostate, my cousin, he died 16 years later of a myocardial infarction that they said was due to complications of chemotherapeutics. So my mom took my dad in the car, and they went down once a month. And within a year, he was practicing medicine again, which he was told that he would never be able to practice again. And it was just a miracle. So they said, I actually had some health problems. I had rheumatic fever as a child. And we all know in the medical profession in the 70s, the only therapy for that was uh, daily doses of antibiotics. Started out with Seclor for 6 years and then had a low dose of penicillin for another, it was 20 years total that I was on antibiotics every day. So I was fine. And Dr. Louise Edwards always says, it's not the straw that broke the camel, it's the load. So the straw that broke my camel, it was a diphtheria tetanus shot that I got when I was about 23. And I did not have, my hands and my feet started sloughing off skin. So I didn't have any skin on my hands and my feet. Maybe I was 21. But the only therapy that they had was steroid creams. And so we would wrap the hands and the feet. I would wrap my hands and my feet every night in steroid cream. And I did that for, 2 or 3 years. You can imagine my immunity at that time.
Oh, wow.
So Mom said, well, let's pile Kirby in the car and take her down to this naturopathic doctor, see what he's got. So he's put me on a very large protocol. And I'd been used to taking vitamins and things. So, because my dad was in complementary and alternative medicine, so it did not, even register that this was something I wasn't supposed to do, So I took all of the stuff, homeopathics, herbals, different types of supplements. And within 4 days, I was the sickest I had ever been in my lifetime. I vomited, diarrhea for 4 days. I didn't know what day it was. But 10 days later, my hands and my feet cleared up. And we all know that the automatic turnaround may not mean that it's gone. It just means your body was that far gone, with your immunity and your body not healing itself. So after that, of course, I continued to go to him and I got better and better. And I said, this stuff is amazing. I want to do it. So I was teaching public school at the time and I really didn't see a transition. So it took some time, kind of get out of that and then go into the medical field. But, the being a public school teacher for 8 or 10 years really did help me a lot. And it has helped me in my practice because it's not just about take this, take that. It's about explaining how our medicine works. And, people don't understand it. So first time out. So you have to explain it over and over and over again. So,
well,
yeah.
Educate. That's one of the philosophical constructs of our medicine, doctors. Sure.
Exactly. That's what we're founded on. And I love our medicine. It's awesome.
Yeah. So you graduated from in Illinois. What's the name of the school?
Illinois, Lord have mercy, National University of Health Sciences. And I attended both the naturopathic medical and oriental medical programs.
Awesome. So, well, that's a great story and so powerful. And I find so many naturopathic doctors actually have a very motivating personal journey that brought them to this medicine. So tell us a little bit about your practices then.
Well, my practice, I love where East meets West, naturopathic meets oriental medicine. So in my practice, I take a true systems-based approach. I use methods for diagnostics. I do, of course, blood testing. I do functional medicine. I just started doing the Carroll food tolerance test. I love that thing. And I have a few other things that, we're going to incorporate into the clinic. Because what I do feel is that you have to really hone in on what's going on with the patient. But like I said, blood testing, functional testing. I also do some quantum biofeedback and energetic testing, as well as other muscle testing techniques such as autonomic resonance testing, total body modification, and those are along the lines of, the applied kinesiology type things. So I do those things, as well as an intake that is systems based. And so the way I treat is we treat the systems, right? If you have a headache, it's not necessarily in your head. It's mostly probably your gut and your liver, honestly. But we whittle away at the systems, and we get things working. And when you get things working, then, symptoms go away. And a lot of times you'll see symptoms you're not even asking about go away. Symptoms that are not even concerning you. Well, that doesn't happen anymore. Well, it's gone, So I really do feel if we support the body with what it needs, and I see it work time and time again. And, it's not I always say, this comes from Ray Stevens, it's not a one-stop beer, ice, bread, minimart, and all that videotape rental, It's not. It is education. It is, the body takes time to work. And so we have to work with that. Now, 6 months to a year, if you're not getting anywhere, then you need to make a change. But most of the time, I see people make changes soon before that. So, it's
awesome. So I've asked all of the doctors this question, a little free information for folks out there. What is your favorite herb and why?
Favorite herb? There are so many that I love. But I fell in love with one herb in school because it did practically everything, and that's burdock. Burdock is also a Chinese medical herb that's used for upper respiratory tract infections. And I think that's probably because of the effect it has on the liver. It's used for diabetes, high cholesterol, all kinds of liver detox. If you look at a detox formula, most of the time it's got burdock in it. It does everything. I love it.
Burdock is a wonderful, wonderful herb. Absolutely. So, I bet people out there are wondering how they can find you. And
we always love the call or the email. And if you want to get in contact with us, our website is www.wildflowerwellnessllc.com. And just hit contact us, and it'll send me an email. Our number is, of course, 704-728-7981. And if you're in the Mississippi area, it's 601-287-3837. Either way, you'll get a hold of me within 24 hours.
Excellent. So wonderful. Now, everybody out there, just join me in thanking Dr. Thompson for joining us today. And, you can come and talk to her. She is live 12 to 1 once a month. And the schedule you can find at medicinetalk.org, which will pop up on the screen here in a minute. We really appreciate you taking the time. Thank you so much for being part of what we're doing and helping to educate the world and tell folks about naturopathic medicine.
Thank you so much for your hard work. I am so grateful to be a part of this. Thank you.
You're welcome, and have a wonderful day.
You too. Appreciate you. Bye.
Visit medicinetalk.org to join us at ND Live today. And be sure to ask your doctor about Full Script.